And Governor Holcomb came out with another executive order yesterday to try to slow the spread of the coronavirus. As part of the order, Hoosiers with chronic health conditions will be able to receive 90-day supplies of non-controlled prescription medications like insulin. So if you're wondering how to extend your prescriptions as you shelter in place, Mitch Legan reports on the best ways to do so.
Governor Eric Holcomb's order for Hoosiers to shelter in place has radically altered life across Indiana. As part of that social distancing strategy, health officials are encouraging Americans to load up on prescription medication to last them for what could be months.
We're being told to make sure we have anywhere from a month to a couple of months of a prescription. That is very necessary. But at the same time, people feel uncertainty about what the rules are about whether they can get access to these medications.
That was Jan Davis's concern. She's 67 and lives in Indianapolis with her husband. She says she's all set now, so I caught up with her over FaceTime to see how she managed to increase her supply.
Well, we're doing what everyone else is doing. We're staying home. Both of us are over 65, so we are not going to the store any more than we have to.
One of the first things Davis did was check which prescriptions were getting low.
I know last year when we went to Florida, we are on Medicare and we wanted to get our prescriptions ahead of time because we were there for a few months, and they told us we could not do that.
The good news is that many insurance companies are lifting some of those barriers. The American Pharmacists Association has encouraged them to do so, and the trade association, America's Health Insurance Plans, has a list on its website of which insurance companies are doing what.
Even if you thought in the past that your insurance was not going to cover a 90-day fill, many are, so you should go and not let that be a barrier.
The type of medicine you're prescribed will determine what kind of extension you can get, if any. Even with insurance companies lifting restrictions, your more controlled substances will still carry 30-day caps. If your prescription has a limit, President-elect of the Indiana Pharmacists Association, Thoma, says you could try asking your insurance company to override that restriction. And if that can't happen, mail order or delivery could be alternatives.
Mail order would be an actual package that's coming in the mail. And it's going to take a little bit more time for that to arrive because you get to put the order in, the pharmacy has to prepare it and then mail it out. Whereas delivery, call the pharmacy, they could fill your prescription and then deliver it out to your home that day.
She says if you still have to go to the pharmacy to fill your prescription, using the drive-thru or curbside pickup can help keep you and pharmacy workers safe. For those who might have trouble paying for the extended prescriptions or don't have health insurance at all, Thoma says many pharmacies have lists of generic drugs at lower prices.
Utilize those coupons when applicable. A lot of our pharmacies have $4 lists for 30-day prescriptions, $10 for 90 days. So, utilizing those resources.
Simon says keeping on top of your prescriptions is not only important for your own health, but also helps keep pressure off the healthcare system during this uncertain time.
If people are not maintaining their maintenance medications, then they're at risk of needing to need emergency care, and that's just going to tax the system even more.
Health workers encourage those with prescriptions to get just enough to hold them over, so pharmacies don't run into supply issues down the road. For Indiana Newsdesk, I'm Mitch Legan.